Okay,
Okay.
my name is Chelsea, and I'm going to be inserting a nasogastric tube. The first thing that I'm going to do is I'm going to be outside of the patient's room, and I am going to check the physician's orders, make sure that the patient is whatever patient I'm going to be doing that. Then I'm going to gather all my supplies and enter the patient's room. First thing that I'm going to do is verify which patient is I'm going to be using, and I'm going to check the patency of the nerves. And there are no deviations. I would ask if he's had any previous surgeries in his nose. If not, I would go ahead and measure the tubing using the next. I would go from the nose back around the ear to the xiphoid process. And I would tape the tubing, and then I would go ahead and I would be ready to start my procedure. First thing I would do is I would wash my hands. Apply clean gloves. Then I would go ahead and lubricate the end of the syringe about 4 inches and make sure that there's water available for the patient as needed. I would warn the patient that there is going to be some discomfort, and using the curve facing downwards, I would lift the patient's head back and insert the tube slowly. Then after a few minutes, I would, using my pen light again, I would check the positioning, make sure there's no coiling. I would ask the patient to talk. If there's any coughing or choking, I would allow the patient to breathe for a minute, and then I would reinsert the tubing. So now I'll continue to go down. If there's any resistance met, again I'll go slowly. And then after I go as far as the tape, I just won't go any further. I would tape the patient's cheek, and now I'm going to check for the positioning. Using a 30 milliliter syringe, I would aspirate the stomach contents, and as needed I would check the pH. The most definitive gold standard checking would be an x-ray. And I would check the amount as well as the color. Then I would, using my stethoscope, I would place it over the stomach. I would reinsert, and there would be a swishing sound. And again, you would verify the position with an x-ray. Then I would remove, connect this to suction on the lowest interval possible. Then I would go ahead and tape the tubing to the patient's nose, as well as pin the tubing, where am I saving it, to using, I would pin it to the patient's shoulder, still allowing him to move up and down. This whole time I would make sure that the patient is in high fowlers, which he already is, and he would remain there. Then for irrigation, I would have some sterile water. I would withdraw 30 milliliters, and also before I do the irrigation, I would go and document everything about the tubing as well as how the patient tolerated it, if there was any problems, the type of irrigation listed, an x-ray if it was needed, and the pH of the solution, and how the patient tolerated. Then for the irrigation, I would insert the 30 milliliters, then I would withdraw, again making sure the patient's in high fowlers. If there was any differential between the amount that I inserted, the normal saline, to the amount I withdrew, I would document that. Now I will discard I got, and I would hook this back up to suctioning, making sure that the patient is comfortable and that they have all their belongings. I would go and I would document the amount of taken bag, whether it was more than 30 milliliters or not, as well as the type of, earlier I would have documented like the type of tubing and how much tubing was inserted and how much was out. So then I would clean my hands